Welcome to Module 10. This is Bonnie Magtibay from the Philippines again, and our focus now is on hand hygiene in healthcare facilities and how you can improve it as part of WASH Fit.
In this module, you will deepen your understanding of the essential role of WASH in hand hygiene practices within healthcare settings. You will learn how WASH underpins the 5 golden rules for hand hygiene, critical in preventing healthcare-associated infections and fighting antimicrobial resistance. You will explore the importance of bimodal strategy for improving hand hygiene. You will also discover the necessity of ongoing training for healthcare workers and managers, focusing on the right moments and techniques for hand hygiene. You may also wish to take the open WHO course on standard precautions for hand hygiene. No health system is free of avoidable infections. These infections, acquired through delivering care and from the healthcare environment, affect patients, their families, and health workers in many different ways. Infection prevention and control measures are proven to prevent harm. Everyone can play their part in making people safer in healthcare. This is a key element of WASH Fit. WHO offers guidelines on infection prevention and control, or IPC, and hand hygiene, outlining necessary infrastructure, behaviors, and practices to prevent infections in healthcare settings. These guidelines are crucial for mitigating the risk of infections, including those resistant to antibiotics, a growing global challenge. Strict hand hygiene standards prevent infection transmission, as touching patients and surfaces can contaminate hands, turning them into vectors for transmitting harmful microbes. Achieving consistent hand hygiene remains a challenge globally. You'll explore why and what can be done. Did you know that every day we shed about 1 million skin flakes? Microbes are everywhere, not just on our skin, but also in various environments. The survival time of these germs on hands varies. Some last only 2 minutes, while others can persist for up to an hour. Certain microbes can even survive on surfaces for extended periods, increasing their transmission risk. For health workers, it is especially relevant that their daily tasks, whether assisting patients, checking vital signs, or touching surfaces around the patient, even cleaning patients' rooms and bathrooms, can lead to hand contamination with thousands of germs. Data reveal a pressing issue in healthcare. 1 in 10 patients may acquire an infection, with over half of surgical site infections potentially resistant to antibiotics. Effective IPC control can reduce this infection by up to 70%, yet hand hygiene compliance often remains below 40%. Improving hand hygiene practices could prevent up to 50% of avoidable infections, offering significant health and economic benefits. Recent WHO surveys show many countries lag in hand hygiene efforts. Shockingly, 1/3 of healthcare facilities lack proper hand hygiene resources, and 1.8 billion people use facilities without basic water services. In the least developed countries, half the facilities lack basic water services, highlighting a dire need for improvement. Effective hand hygiene improvement strategies can prevent up to 50% of avoidable infections in healthcare and generate economic savings. These rules stress the importance of timing and technique in hand hygiene, integrating seamlessly into routine patient care. Hand hygiene must occur right at the point of care and during 5 critical moments in patient care. What do we mean by point of care? It is defined as the intersection of the health worker, the patient, and a care or treatment involving touch. There may be multiple points of care across a facility or ward. Hand hygiene infrastructure and products should be in place and easily accessible at all points of care. If health workers have to leave a patient's side to clean their hands, the likelihood of performing hand hygiene drops. Alcohol-based hand rub is preferred for efficiency, effectiveness, and skin tolerance, though soap and water are required for visible dirty hands. The right technique and adequate time spent on hand cleaning are essential for effective hand hygiene. The 5 moments for hand hygiene, a cornerstone of infection prevention, delineates key times for decontaminating hands to curb microbe transmission. This evidence-based strategy doubles as an educational tool, often represented visually on posters throughout healthcare facilities. It is emphasized when and how hand hygiene should occur to prevent infections efficiently and conserve water resources. You can revisit the Wash Fit Water module to learn more about other water conservation strategies. The main benefits of the 5 moments approach are: 1. It simplifies the concept of timely hand hygiene across different settings. 2. It seamlessly integrates hand hygiene into healthcare workers' routines. 3. It enhances recall, ensuring consistent hand hygiene practices. 4. It facilitates standardized training and monitoring. And finally, 5. It is universally applicable regardless of the care setting. The timing involved in hand hygiene is as important as the technique. It is the timing, the exact moment in the workflow when hands should be cleaned, that significantly enhances patient and health worker safety. To ensure that hand hygiene has maximum impact, it must be performed with the right technique for the right length of time. Using an alcohol-based hand rub should take between 20 to 30 seconds, while washing with water, soap, and drying with clean towels should take between 40 to 60 seconds. The evidence tells us that to improve hand hygiene behaviors in healthcare requires more than one approach or method. WHO describes this as a multimodal strategy, an evidence-based approach for improving hand hygiene. The 5 core elements of the multimodal hand hygiene improvement strategies are: systems that enable hand hygiene at the point of care. That means the right infrastructure, resources, and equipment in place. Training and education, monitoring, auditing, and feedback, reminders and communications, and lastly, a supportive culture in the facility. Focusing solely on one of these methods is insufficient to change health worker behavior. You will need to employ a combination of strategies alongside the Wash Fit continual improvement framework. Let's explore the 5 key actions: building the necessary physical infrastructure like water access, sinks, and alcohol-based hand rubs; educating healthcare workers on hand hygiene importance, methods, and timing; monitoring and evaluating practices while providing feedback; using reminders and motivating strategies to encourage adherence; and cultivating a culture that values hand hygiene. These actions, building, teaching, checking, selling, and living hand hygiene, are interwoven to ensure that practices are adopted and sustained. The Wash Fit assessment asks if staff can readily perform hand hygiene at critical points by checking the availability of hand hygiene stations at all points of care. As we have seen, these points are vital for maintaining high hygiene standards and preventing infections. This assessment aligns with the WHO's 5 moments for hand hygiene, checking for the availability of accessible and functional hand hygiene facilities to ensure compliance and patient safety. Leadership is crucial in driving the necessary system changes to support effective hand hygiene. including policy implementation, resource allocation, and developing a supportive culture. Training and education on hand hygiene are fundamental for IPC to facilitate thorough comprehension and adherence to hand hygiene protocols. This is the teach it component. The wash fit assessment asks if there is comprehensive training for all staff, including those in auxiliary roles like waste handling and cleaning. To improve hand hygiene training, you should appoint a dedicated individual or team to regularly review and update training programs with the latest hand hygiene recommendations, reflecting new evidence relating to any new pathogens. Conduct targeted training needs assessments to identify and address knowledge or skill gaps to create customized and effective training programs. Sell It emphasizes the continuous and innovative promotion of hand hygiene, engaging healthcare workers, patients, and visitors to develop a culture of cleanliness. You can use a variety of promotional materials such as digital screens, badges, stickers, and wearable items with hand hygiene messages to maintain interest and avoid message fatigue. Use social media, podcasts, and SMS messages to extend the campaign's reach, making information sharing dynamic. Participating in global campaigns like WHO's annual Hand Hygiene Day on 5th of May and local initiatives promotes a sense of community and collective action. Engaging the community through discussions, demonstrations, and competitions, and sharing impactful testimonials from within the healthcare community are also effective. In the Live It phase, the emphasis is on creating a culture of safety and initiating a change within the healthcare facility that underscores the critical nature of hand hygiene and infection prevention. This involves engaging the WashFit IPC quality team within facilities. Indicators in the management and workforce domain allow you to assess this. Regular performance reviews are crucial, acknowledging the achievements of high performance and offering constructive support to those in need of improvement. Every member of the auxiliary staff should have a clear, documented description of their WASH and IPC responsibilities. Cultivating an environment that values accountability and continuous enhancement enable every individual within the healthcare setting to contribute actively to maintaining high standards of hand hygiene and infection prevention. This culture is influenced significantly by the leaders and managers. If leaders and managers fail to demonstrate commitment, it's unlikely that hand hygiene will be valued, supported, funded, or championed. To improve this culture means regularly asking the following. Is hand hygiene a priority for managers and senior leadership? Are they engaged and do they practice what they preach? How can you increase the visibility of role models in the facility? Could they wear a badge or receive some other form of recognition to encourage them to influence others? You have reached the end of this module. Essential points to take away are as follows. Without prompt and proper hand hygiene, achieving health for all through quality care remains unattainable. An environment equipped with necessary water, sanitation, and hygiene services is crucial for enabling hand hygiene practices at the correct times and in the appropriate manner. Implementing and customizing a multimodal strategy enhances access to hand hygiene facilities and fosters better hygiene behaviors. Improving hand hygiene services as a gateway to broader infection prevention and control enhancements. And hand hygiene stands as a critical performance metric in diminishing the impact of antimicrobial resistance controlling outbreaks. and preventing all preventable healthcare-associated infections. Please explore the reference section of this module for links to all mentioned resources.